Namaskar. I am Dr. Abhijit Joshi, orthopedic surgeon based in Pune, specializing in trauma, joint replacement, osseointegration, and diabetic foot. Today's topic is fractures of the wrist, where I will tell you in short all that you need to know about wrist fractures. As you can see, the bones of the wrist are made up of carpal bones and the forearm bones, which are called the radius and the ulna. This is the radius, this is the ulna. The carpal bones join the hand to the forearm. In this video, we shall talk about the fractures of the lower end of the radius, which is the most common fracture that occurs around the wrist. Now, these are X-rays of the wrist from the front and from the side, and this is where the fracture most commonly occurs here. Now, how do fractures occur? Fractures of the wrist most commonly occur due to fall on the outstretched hand, and the whole body weight comes on the wrist and the bone fractures. It also occurs if there is an accident like a heavy object falling on the wrist, or in a polytrauma where the wrist fracture is part of many fractures. It also occurs in a bone which has been weakened due to osteoporosis or a pre-existing pathological condition, say like a bone tumor. A minor injury can then cause a fracture. In this picture, you can see how the fracture occurs when a person accidentally slips and falls, and the whole weight of the body comes on the wrist, and then it gets fractured. Commonly, when a motorcycle skids and the hand is outstretched, the whole weight of the body and the motorcycle comes on the wrist and it gets fractured. Here you can see that there is a tumor at the lower end of the radius and the bone is weakened, and a small injury can easily fracture this. That is a pathological condition. So how do you diagnose or find out if you've got a wrist fracture? Usually there is a history of a fall or an accident, and there is severe pain and swelling around the wrist joint as compared to the other normal side. There is deformity at the wrist, which is commonly known as a dinner fork deformity. The wrist looks abnormal as compared to the normal side, and there is difficulty in movement of the wrist. Finger movement is possible but is painful, and the wrist is swollen. A definitive diagnosis is obviously done by taking X-rays, and sometimes a CT scan is required. This is the classical dinner fork deformity. Here you can see that the wrist has fractured and it is broken into two pieces, first piece and second piece. When the injury is severe, it can break into multiple pieces. When the bone is broken in more than two places, then it is called a comminuted fracture. It is also called a comminuted fracture when there are more number of pieces. Now here is an X-ray of the comminuted wrist. Here you can see that the wrist is broken in many pieces, and apart from being broken, it has also moved in an upward direction. This is the normal and this is the upward direction, dinner fork deformity. Now, what is the emergency treatment? The most important thing is to stay calm and splint the fracture. A splint is a temporary support to the fracture. If available, a forearm wrist brace as shown here should be applied and the arm kept in a sling. Only a simple sling can also be applied. A ruler, measuring scale, or a thick rolled newspaper which is well padded can be applied to the wrist, and it can be wrapped in a bandage or taped so that the wrist does not move, and that reduces further damage to the soft tissue. The fracture pain will be reduced when the fracture fragments do not move. That is the purpose of splinting. If available, ice fomentation should be done to the affected part. What should not be done is ice which is kept on the wrist and then wrapped with a bandage. Try to avoid unnecessary movements of the fractured wrist. Sometimes well-meaning people can move the wrist to loosen it or give a massage and apply various sprays and ointments. Generally, this is not a good idea. Keep the arm elevated, that is, keeping it above the level of the heart. Now, if the patient is lying down, keep the arm on the chest, which is the simplest thing to do. And the other thing you can do is just keep the arm in a sling. What should be strictly avoided is applying hot fomentation and massaging the wrist. Now, what is the treatment of wrist fractures? The treatment of the wrist fractures is to align the broken bone and hold it in a correct way so as to heal it in an anatomical position. This can be achieved without surgery or with surgery. It is called conservative or surgical. Let us now discuss the treatment modalities. The most common is application of a plaster cast. If the wrist is broken only in two parts and is not much displaced, or if there is only a crack or incomplete fracture, then a plaster cast is applied, which is removed after 6 weeks. If the fracture is displaced, that is, the broken bones have separated a lot, then a closed reduction and cast application is usually done under a nerve block or general anesthesia. When the fracture is broken in many places and is grossly displaced, then sometimes surgical intervention is required, and this can be in the form of K-wires as shown here. That is, pins are inserted from outside and plaster is applied. As you can see, multiple pins are holding the fracture. If the skin is severely damaged or when the bone is broken in far too many places, that is a comminuted fracture, then often an external fixator is applied. Here, strong pins are inserted into the bone and they are joined together with a rod. This is the connecting rod. Sometimes a formal operation is needed wherein the skin is cut and the fracture is fixed with plates and screws. As you can see in this X-ray, the plate is applied to the bone and it is held with screws. The plate is made of either special stainless steel or titanium. In elderly, the plate need not be removed after bone union, while in young people, it can be removed after 1.5 to 2 years. Now, what are the complications that can occur? Some complications like malaligned healed bone, a stiff wrist, tendon rupture, or a nerve injury can occur, details of which are beyond the scope of this discussion. In summary, wrist fractures are common and mostly require setting under anesthesia. While some require a surgical intervention, 6 weeks is usually the time that the fracture requires to unite. Physiotherapy then plays a crucial role in regaining the wrist movements. Exercises after a healed wrist fracture will be demonstrated in another dedicated video. Thank you for watching. Kindly like and subscribe.